Dear students, today we will talk about the gastrointestinal tract. Actually, this will be the first of the two lectures about the GI tract. And of course, we will start at the beginning. So we will start with the oral cavity, pharynx, and the esophagus. And these will be the three organs I will talk about today. And then in the next lecture, we will go on from the stomach to the end of the GI tract. So let's start. I will start to share my picture. So the oral cavity, so as the first part of the GI tract, is composed of two main parts. The first part is found in front of the teeth and the bucca, in between actually the teeth and the bucca, and this is called the oral vestibule. The second part, which is found behind the teeth already, is the oral cavity proper. This is where we find the tongue, for example. So this is the main part of the oral cavity. But what is the content? Of course, you know, lots of structures which are found in the oral cavity, like the teeth, the tongue, but there are some structures which are not that very well visible, and these are, for example, our salivary glands. Okay, we have three main salivary glands connected to our oral cavity. The biggest one is the parotid gland, or parotis, which is found in front of the ears, quite superficially, actually, just below the skin. Okay, and this gland has a longer duct which will pierce our bucca, the buccinator muscle in the bucca, and this is how it will open up into the oral vestibule. Okay, this will be the spot where it opens in the opposite side to the second upper molar tooth. Okay, this is the so-called stenon duct and the opening of the stenon duct, which is the duct of the parotid gland. The parotid gland can be inflamed, and this is the mumps disease, but previously it occurred quite frequently, but since 1991, at least in Hungary, there is a vaccine, an obligatory vaccine for the mumps, which is a combined vaccine against measles, rubella, and mumps. And since then, we do not really have any patients with mumps. Back then, in my time, we did not receive any vaccine against the mumps, so I had the mumps, for example. In this case, the parotid gland gets swollen, and you can see in the picture how big it can be. It's really quite awful looking thing. Okay, the whole neck and in front of the ear will be swollen, and it could be quite dangerous because this disease can have complications like meningitis or testicular inflammation, which can lead to infertility as well. So could be quite severe as well. This is why it's good that we have a vaccine against it. So the parotid gland is the biggest salivary gland, and we have two other glands which are much smaller, the submandibular gland and the sublingual glands. Okay, the submandibular gland is found just below the mandibule, and the sublingual gland is found inside the mucous membrane of the oral cavity, the floor of the oral cavity. And these two glands will open up in the region below the tongue, which is called the sublingual region. Okay, this is where they open, so into the oral cavity proper. And these three big salivary glands, these will produce the saliva. Okay, per day, half liter saliva is produced by these three main salivary glands. And although the parotid gland is the biggest, the most of the saliva will be produced by the submandibular gland. Okay, and the saliva contains lots of water, but it also contains some ions and also digestive enzymes like amylase or lipase, which will start to digest the carbohydrates and the lipids, and the saliva contains mucin as well. And it's very interesting that in different states of our autonomous nervous system, we have different kinds of saliva. When we are in danger, when we are in fear, or we are in stress, and our sympathetic nervous system is active, then more mucin will be produced and the saliva gets more viscose. In case of a parasympathetic innervation and the parasympathetic activation, the digestive enzyme part of the saliva will be more than the rest, so we can start to digest. So when our parasympathetic nervous system is active, then we are usually in a resting phase, when in peace, when nothing bothers us. Okay, this is when our parasympathetic nervous system is active, and this is the best time actually for digesting as well. In the oral cavity, we have also the teeth. The teeth have three main parts. The upper part above the gingiva is called the crown, which is on the surface, outer surface, is covered by enamel. The lower part, inside the bone, inside the alveolar bone, is the root. The root of the teeth are covered with cement. And both in the crown and in the root, below the enamel and the cement, we have a layer of dentin, which is actually a bone-like tissue. Between the crown and the root, as a transition, we have the neck, where actually the enamel will continue as cement in the root. And inside the teeth, we have a pulp, actually a cavity filled with connective tissue. And this is the space where the vessels and the nerves can reach the teeth. As you may know, there are four main types of teeth: the incisors, the canine, the premolars, and the molars. And you may also know that there are two main types. The deciduous teeth, which we lose after a few years, and then we change to the permanent teeth. And in this table, you can see how many of each types we have per quadrant. You may know that the teeth are divided into four quadrants. There is an upper right, an upper left, lower right, and lower left quadrants. And per quadrants, in case of the deciduous teeth, we have two incisors, one canine, and two molars. So altogether 5 teeth per quadrant. So it means that we have altogether 20 deciduous teeth. And in case of the permanent teeth, 2 incisors, 1 canine, 2 premolars, and 3 molars. So 8 per quadrant, altogether 32 teeth. In the oral cavity, we also have the tongue. Okay, the tongue have 2 main parts. The back of the tongue is called the root of the tongue, and this is actually filled with lymphatic tissue, lymphatic follicles, and this is our lingual tonsil. And the anterior 2/3 approximately of the tongue is called the body of the tongue, and this is where we have different papillae. The papillae are actually protrusions on the surface, and we can have different papillae. There are papillae which contain taste buds, okay, with which we can perceive the taste sensation, And there are some papillae which have mechanoreceptors and with which we can perceive mechanical signals like touch, sensation, or pain, temperature, and so on. And the most anterior part of the tongue, the tip of the tongue, is called the apex of the tongue. Below the tongue, where we already mentioned that where the sublingual and submandibular glands open, this is the so-called sublingual region. This is a very important region for pharmacists as well, because this is a very well capillarized region, just like in the nasal cavity we've talked about in my previous lecture about the respiratory system. So in the nasal mucosa, it's also very rich, has a very rich blood supply, and the same is true for the sublingual region, where the blood supply is quite rich, and this is why we can use different drugs in the sublingual region. These are the so-called sublingual drugs, where the most popular one, most famous one is the nitroglycerin. And this is a very good place for resorption to the drugs, because drugs can act very quickly, because they immediately get into the systemic circulation. They do not go through the GI tract. They don't have to pass the liver, so the liver won't detoxify the drug. So it will be more effective, and much quicker will be the effect of these drugs. And this could be used in form of either tablets or drops or spray, in any forms actually. So it's a very important region for drug resorption. The tongue is composed of muscle, of skeletal muscle tissue, and we can differentiate between extrinsic and intrinsic muscles, so external and internal muscles. Actually, the external muscles will move the tongue forward, backward, up and down, and so on. The intrinsic muscles can change the shape of the tongue. Okay, and it is a very interesting organ, because there are no other organs in the human body where the skeletal muscle fibers are oriented in the three main planes. So there are sagittally running fibers, longitudinal fibers, there are vertically running fibers, and there are also transversely running fibers. And this orientation of the muscle fibers make the tongue one of the strongest muscles in our body. The oral cavity is in connection with the pharynx, with the oropharynx, and we can get into the pharynx through this opening between the oral cavity and the pharynx, called the isthmus of Fauces, isthmus of the pharynx actually, when we translate it. And this opening is well visible. If you open your mouth, then you will quite well see it, and I would like to ask you to do that after the lecture, just to take a look in the mirror, open your mouth, and try to recognize these structures which are visible in the picture. So you will see the soft palate, and the soft palate, the muscles of the soft palate, like this structure in the midline called the uvula. It's actually a small muscle with some connective tissue and epithelium. And there will be two arches visible. The anterior one is called the palatoglossal, connecting the palate with the tongue, and the posterior one is called the palatopharyngeal arch. And in between the two, you will be able to see your palatine tonsils as well. So after the oral cavity, and the GI tract continues in the pharynx. We already talked about the parts of the pharynx and the main structures of the pharynx in the respiratory system lecture. So you can go back there and hear the details of this. I won't tell this again. Okay, but just a few things that the three main parts are called the nasopharynx, the oropharynx, and the laryngopharynx, or they could be called with synonyms like epipharynx, mesopharynx, and hypopharynx. And the pharynx is actually a muscular tube which hangs down from the skull, and which is on the anterior part is open, and here it connects to three main cavities like the nasal cavity, the oral cavity, and the larynx. Okay, and this muscular wall, the muscular tube, is composed of two main muscle groups. One is the circularly running constrictor muscles, and the other one is the longitudinally oriented elevator muscles, which can elevate the pharynx as we swallow. Okay, and these slides you've already seen in the previous lecture regarding the respiratory system, where I talked about the main structures of the nasopharynx, oropharynx, and laryngopharynx. So the pharyngeal tonsil, the auditory tube, we already discussed these. I have the same slides, put the same slides here as well. We saw the isthmus of the fauces as well, from anterior and from a posterior aspect as well. And then in the next picture, we can see the opening, the inlet of the larynx as well. And then the pharynx will continue in the next organ, which will be the esophagus. Okay, and the esophagus starts approximately at the level of the 6th cervical vertebra. And as I already mentioned, this will be the continuation of the pharynx. The esophagus has three main parts. On the neck, we have the so-called cervical part. Inside the thoracic cavity, the thoracic part. And as the esophagus pierces the diaphragm and reaches the abdominal cavity, we have a very short abdominal part, just before the stomach. One of the main structures of the esophagus, which is very important in different kinds of illnesses, is the lower esophageal sphincter muscle. There is an upper one between the pharynx and the esophagus as well, but this lower one is physiologically much more important, because in normal cases, after the food left the esophagus and get into the stomach, this lower esophageal sphincter closes and prevents the content of the stomach from getting back into the esophagus. Okay, and as you know, the stomach has a very acidic content, so actually it prevents from this acid, so that this acid will reach the wall of the esophagus and damage the wall of the esophagus. And in those cases when this esophageal sphincter cannot close properly, when it's in a relaxed state, what happens is that the content of the stomach, this acidic content, can get back into the esophagus and damage the mucosa of the esophagus. And this is what we call the reflux disease, or the nicer name is the gastroesophageal reflux disease, GERD. You will learn about this in inner medicine later on. Okay, but the main cause is that this lower esophageal sphincter is in a relaxed state. It cannot contract enough, and this is why the content of the stomach can get back into the esophagus. There are different ways to treat this pharmacologically and non-pharmacologically as well, which usually include some lifestyle changes, or if you discontinue to take certain drugs, which, for example, relax your muscle, your sphincter muscle. And the most frequent pharmacological way of treating this reflux disease is to take proton pump inhibitors, with which we can actually inhibit the acid secretion in the stomach, and this is actually what we can get with using antacids as well, which are also very, very commonly used. These are actually only for relieving the symptoms, but of course the underlying cause will be not solved with these kind of drugs. Okay, so these are only against the symptoms, and we can remove the symptoms but not the cause. And this would be the goal, to know, to discover what the cause is, what causes the reflux disease. And if you know this, then of course it will be easier to treat the causes as well and not just the symptoms. The histology of the GI tract, of the beginning of the GI tract, looks the following. In the oral cavity, we have this wall structure, which is quite general. So in the inside, as the inner layer, we have a mucous membrane, which is composed of an epithelium on the surface, and below it, we have a connective tissue layer with the different glands. This could be mucus and serous glands. Okay, under this mucous membrane, we will have a layer with muscles. This is the tunica muscularis. And in case of the oral cavity, in the tunica muscularis, we have skeletal muscle. And as the outermost layer, we will have loose connective tissue, which we call the tunica adventitia. In the pharynx, and this slide you've already seen again in the respiratory system lecture, you can see that in the oral and the laryngopharynx, where the food goes through, we have the same epithelium as in the oral cavity, so the stratified squamous non-keratinized epithelium. In the nasopharynx, as the continuation of the nasal cavity, we have the respiratory epithelium, which is, hopefully you already know this, but this is a pseudostratified columnar epithelium with kinocilia on the surface. And the wall structure is similar than as in the oral cavity, but we have one extra layer, which is called the tunica submucosa. It's an extra connective tissue layer under the mucous membrane. And in the esophagus, we have an extra layer again in the mucous membrane. So here the mucous membrane is not only two-layered, but three. As the innermost layer, again, we have a stratified squamous non-keratinized epithelium. Then we have some connective tissue, and as the extra layer, we have a smooth muscle layer. This is the muscularis mucosae. Okay, this smooth muscle is important for the peristaltic, for example. Okay, so the contraction of this muscle can cause peristaltic movement in the esophagus. Underneath this layer, we have the submucosal layer, which is a connective tissue layer. And then we have, again, the muscular layer, the tunica muscularis. In case of the esophagus, in the upper parts of the esophagus, the tunica muscularis is composed of skeletal muscle. And as we go deeper down towards the stomach, it will change to smooth muscle. Okay, and this layer is again a very important layer for the peristaltic movements in the esophagus. And as almost always, as the outermost layer, we have a connective tissue layer, which is a loose connective tissue, and which is called the tunica adventitia. Okay, in the picture you can see how the different states of the esophagus are. in a contracted, and R is missing from the slide, contracted state. Of course, the muscle fibers, or in case of smooth muscle, the smooth muscle cells contract, so the lumen becomes smaller and not so round, but more star-shaped, and the whole wall will be smaller in diameter. And of course, in a relaxed state, when the muscle cells, muscle fibers are relaxed, then the lumen will be bigger and much rounder. And this is what you have to know about the first part of the digestive tract. And in the next lecture, we will go on and we will discuss the rest of the digestive system. Thank you for your attention. Bye-bye.